Good morning. We just had a really impactful conversation with women who are so extraordinarily committed to the same cause we all share, which is to ensure that more women and their babies survive childbirth, pregnancy. And that is not the case here always in the Bronx, which has the highest maternal mortality rate in our city, and the numbers are just unconscionable. So I want to thank Borough President Vanessa Gibson, a friend for many, many years, for hosting us here today and welcoming me back to the Bronx. We also have Assembly Member Tapia, who was with me yesterday at the parade. We marched together, so proud for the Puerto Rican Day Parade, and Councilmember Sanchez, who knows a little bit about childbirth, expecting a baby by December. So great to have them here and the individuals who stood up with us. But this is a crisis, full stop. This is an issue that a lot of people don't talk about because it may not affect their community. This is heavily concentrated in black and brown communities, and women have 3 to 4 times higher rate of mortality than women who are not women of color. So think about that, process that. And then the question is, what are you going to do about it? I have made this one of my signature issues since becoming governor, listening to advocates, champions who are incessant about doing more to save lives. And one of them is to say, we need more assistance for these women while they're going through the process. We started a doula directory. I just announced today that our Commissioner of Health, McDonald, is first time ever in our state's history making Medicaid available to cover the cost of doula care. These are people who understand the experience, who are their advocates, they're their champions, and we just heard stories of how they've literally saved lives just this week because they noticed something and called the doctor and says, you have to do something about this situation, bringing women into the hospitals who otherwise were told you don't need to show up. So it's powerful. But also we need to continue funding the programs that are in place. Today we're announcing an $8 million investment in the Morris Heights Health Center. I just toured it with the CEO this morning. We're going to create a maternal health center of excellence. The Bronx deserves to have this center of excellence. It is long overdue. And the project is start to begin in 2025 and all done by 2027. Maybe for your next children too. Okay, next. We're ready for more by then. And also, we're excited about what we're doing. But the mortality rates in our country overall are staggering compared to other industrialized nations, and it's a point of great shame for all of us. That's why the state of New York will continue to lead on this issue and make sure that we focus on a place like the Bronx, which sadly has been the epicenter of this crisis, but at some point we're going to turn that narrative around with all this assistance, and people will be looking to the Bronx for the model of what to do to save women and children's lives. So I want to thank our leaders for being with me here today. Happy to take any questions.